about a little bit about the history of your company. Very interesting. Practicing dentist, and you had a problem.
I've been a practicing dentist for 27 years. I've been traveling around the state of Texas performing IV sedation for clients for many, many years. But I personally had a problem in my office performing IV sedation. It was a tragic incident. I was performing IV sedation on an asthmatic patient. The patient had a severe asthma attack and she almost passed away. I was totally unprepared for that asthma attack. It was a combination of 3 errors on my part: an improperly constructed medical history, an incomplete emergency drug kit, and a poorly trained staff.
And at this time, were you already certified or licensed for IV sedation?
I was.
Because you guys have extra training than a typical doctor.
We do.
Okay.
And I was already trained in advanced cardiac life support. Thank God the patient survived wonderfully. She recovered. The staff barely recovered emotionally. I came back to the office, there was equipment everywhere. They were off having adult beverages, and I was left in the office looking at this mess. And all of a sudden I realized something had to change. I had to make a difference in the profession.
Good for you. So what do you do now? I mean, we know you have the company, but what time, because you're still practicing dentist, but you have a certain time dedicated to this.
Well,
tell me about that.
Let me first tell you what I decided to do that night, if I may.
Sure.
What I decided to do was to look at the 3 things that went wrong that night and knew what I needed to do to make it right. So the first thing I did, and this is what I do for my clients now, is I have reconstructed the medical history. And the way that we do that for our clients is we have actually gone through and taken each area of the medical history and analyzed that, or reworked that, reworded that. So if a patient tells us they have a particular problem, if they say, I have asthma, and they check yes, my computer system generates all of the next questions.
Additional questions.
It does.
So the current intake doesn't have that?
If a doctor looks at their medical history form, it says, do you have asthma? It checks yes.
And that's it?
Pretty much. It'll ask a few more questions, and the doctor has to think, what is the next?
So you created this drop down that asks specific questions.
It's done on the computer.
Okay, on the computer.
And it may ask a few other questions. Is your asthma controlled? Just a few other questions. And the doctors know that if they're truthful with themselves, they know what it asks or doesn't ask.
Okay.
So my questionnaire does it all for them.
Good.
So it keeps the doctor from having to ask the next question. We are so busy in dentistry, we don't have time to ask them. We don't know what the next right question is.
So the questionnaire was flawed. You fixed that.
I did.
And you know, before we came on, I said, you know, who is your competition? Who else is doing this in a comprehensive way? And you said nobody.
There may be some companies that have an adequately designed health history. There may. I haven't met anyone yet.
As far as your kit, the protocols, I mean, right now you're the only one in the business.
That possibly has the 2 other components combined into one system.
So the first one was that intake kit. What's number 2?
Number 2, and this is what I believe I can offer my clients that does not exist in the market right now, is an emergency drug kit that has the drugs in it, and only the drugs in it that the general dentist needs, labeled in a way that is extremely friendly for the doctor and the staff. That's the most important thing.
That's not the case now with the current drug kits?
Let me say this. The majority of the drug kits that exist have too many drugs in it that the doctors are not qualified to use, not able to use, and can't figure out to use in a crisis.
Okay. Does that present additional liability?
Let me say this. In my own experience, I was qualified, able to use them, and in the moment of crisis, I still couldn't find what I needed, just out of anxiety. But to answer your question, when you buy a drug kit, you legally must be qualified to use everything in it. If any general dentist is honest with themselves and they open up their drug kit, the majority of them have drugs in it they are not legally.
So patient safety in a box. That's what you put together.
That's what I like to call it.
Easier labels to read.
Well, let me give you an example.
Okay.
In all due respect to you, if you picked up this box.
Okay, right.
Look at that, Randy.
Mild allergic reaction. Okay.
Now, if you read that label, if you were my dental assistant, it would tell you what to do with that.
Mm-hmm. Yeah.
So if you noticed,
so this is not what's standard in these drug kits.
What is standard in a drug kit right now would be the
2 tabs immediately, then 1 every 4 to 6 hours.
What would be in your drug kit right now would be the name of that drug. You could find the legal name.
So
of
what's
that drug.
okay? So this says, if we could zoom in on this, mild allergic reaction. So you're saying on a standard kit, it's just going to say the drug Benadryl.
That was all that it would say. So if your doctor were to tell you, my patient's having a mild allergic reaction, go get me that drug.
And in a crisis,
that's all your doctor would have to say.
Okay.
So
chest pain, because I'm looking over there. So there's one. It says.
So if your
angina,
patient says,
or angina, chest pain.
if your doctor says my patient's having chest pain, you don't even need to know anything other than that. You go pick up that drug for your doctor.
I'm ready to go. I could do this, right?
Yes, you may need to someday.
Interesting. Wow. Wow.
So I've relabeled every drug with the layman's term, the dental term, how to use the drug. So every one of the drugs that I train you to know how to use are labeled as such.
Very nice. Okay, so you took care of the kit. What's the third component?
The third component is the training for the staff.
Okay.
So we've gone through.
Is it? I mean, most doctors, that's it. They don't involve their staff. That
They
means
don't.
There's no protocol like a fire drill.
Well, most continuing education courses only involve the staff, unless they're sales courses or insurance coding courses or
very interesting.
or assisting. So what I've done is I've brought the training to you. So in the afternoon portion of the course, we go through the role playing like I had mentioned, and it's interesting because we have the doctor in the primary role, each of the dental assistants in their role, and that is completely outlined in our training manual. And then in the videotaping, they're able to see how they come out of their shell and how they feel more comfortable in the role playing. Because in a moment of crisis, they need to have been in that role, becoming the doctor's assistant, becoming the person that goes and makes the 911 call, becoming the person that feels more assertive, even going to the drug kit to get it. So in that training, not only do they learn how to be the role, but then they're also learning how to make a 911 call. So I've included the text for a 911 call. I've included all the other training materials. There's nothing left to chance, and there's nothing left to question.